Hello and welcome to ashford.com. You are watching an interesting video on the design of a new chip capable of simulating a tumor's microenvironment to test the effectiveness of nanoparticles. Please read this disclaimer carefully. The engineers who created the new chip, known as the Tumor Microenvironment on Chip (Tumor) device, hope that it will open doors for researchers to study the barriers that prevent the targeted deliveries of cancer therapies. Research teams are investigating different targeted delivery mechanisms that are able to selectively attack tumor tissue. One method of delivery currently under investigation is to use nanoparticles tiny enough to pass through the pores of blood vessels. Because the endothelial cells in healthy blood vessels are neatly organized, with small pores in their junctions, while the endothelial cells in blood vessels around tumors are irregular and misshapen, with larger pores, these designer nanoparticles may be able to differentiate between the two. Bumsoo Han, a Purdue University associate professor of mechanical engineering, says that if nanoparticles were designed to be the right size, they could selectively move toward only the tumor. Han believes that the Tumor device may be useful in solving some of the problems researchers investigating the nanoparticle approach have come up against. For instance, one particular problem associated with the nanoparticle approach is that the interstitial fluid within tumors is of a greater pressure than the interstitial fluid surrounding healthy tissue. This increase in pressure is enough to push out most drug delivery and imaging agents. Only a small percentage of them succeed in reaching the tumor. The Tumor team report that their device is capable of simulating the tumor environment to such accuracy that it can provide detailed data on how nanoparticles may negotiate the environment. About 4.5 square centimeters, the chip contains cultures of tumor and endothelial cells within microfluidic channels, as well as an extracellular matrix of collagen, the substance found between cells in living tissue. As the chip is designed to mimic cancer in humans, its designers believe that it offers an alternative to both Petri plates, which are unable to reproduce the complex tumor microenvironment, and research in animals, which does not always show how potential treatments might affect humans. The Purdue team tested the movement of nanoparticles within the chip using human breast cancer and endothelial cells. Next, the team will study anti-cancer drugs using the chip. In the future, they may use Tumor chips to grow tumor cells from patients that can be used to assess how effective specific drugs may be in those patients. The team's results so far are published in the Journal of Controlled Release. References